You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers, what my first guest calls full mouth reconstruction. According to him, he says your teeth and gums are never too far gone or bad to have the smile you've always wanted. With us in studio, we have Dr. Robert Amirian. Dr. Amirian, welcome to the program.
Pleasure to be here. Thank you.
Now, you brought a stack of photos, so we'll get to as many of those as we can. But give us a working definition of this full mouth reconstruction. Like, what is it?
So full mouth reconstruction are patients that need a change in their smile. They need a new smile makeover.
Okay.
So we're able to help them go from infection, bad gums, bad teeth, cavities, broken down teeth, missing teeth, to giving them a whole new smile.
Now, you don't, and we talked about this when it comes to implants, you don't just do one thing at your office. I mean, if you could save teeth, you will. Can you elaborate on that?
Yeah, I mean, some patients we can save and work with what they have and give them a whole brand new, beautiful smile, keep things natural, keep things looking healthy. And the best thing you can do is save your teeth if we can. I always try to save teeth if I can. That's my number one priority. In some cases we can't, but most of the time we can. And if we can save teeth, give them a beautiful new smile, then that's what we do. Okay, good.
So you brought some photos. What are we looking at?
So yeah, this is a patient of mine. This is Marie.
Okay.
Marie, she came to me and she said, I said to her, "What brings you in, Marie? What brings you in?" She said, "Look at me." That's where her words were, "Look at me." And I said, and I knew immediately right away she needs help. Okay. I know she's in a bad place. She told me she's not smiling. She can't eat. She can't chew. So if you look at Marie, in those photos, we actually had to make her smile. She was not smiling. She couldn't eat properly. She was having these missing teeth. She was suffering with this for such a long time.
Do you think people got the wrong impression about her?
I do. So with a combination of procedures, we were able to give her a total smile makeover.
Okay.
You can see in her photos, if you look at her, we were able to get her with sedation in a nice, comfortable position. She was put asleep in a nice, safe environment. We took care of her. We gave her a whole new smile makeover. Look at her eyes in the after photos. You can see she's a whole new person. Look at her eyes before and after. Before,
she was almost squinting.
She's squinting. Her face is in a whole different facial structure. Look at her after photos. Her eyes, her face. She almost looks 30 years younger. You know why? Because it's all because of the teeth. The teeth are the start, a gateway to where the happiness comes in, where the joy comes in, where confidence comes in, where she's eating, speaking, smiling better. Look at her before and after photos.
Okay.
Would you say she's more attractive now in the after photos?
Yes.
Okay. That's everybody. That's exactly what happens.
Teeth make you look better.
Exactly. Smile makeovers just change the whole smile.
Now, when you're on the consult with a patient that they don't know their options, maybe they're kind of depressed or down and out about their situation, do you ever get excited in your head, like knowing how good this is going to be, like once they decide to move forward? Tell me about that.
Yeah, that's actually the best part of my job, really. When I'm talking to the patient and I see that they're just deflated, they've lost hope, they don't know where to go, they don't know what their options are. They maybe been to 3 or 4 different dentists that said, no, I can't help you, ma'am, or the only thing I can do for you is a denture, or just sorry, you have no bone, or just nothing we can do for you. That's where I come in, and I feel the best part of my job is when I'm able to now give them something they were hoping to hear, but they haven't heard for many years, which is, I can help you. I can change your smile. I can give you what you're looking for.
How old can you be? Like, what's your oldest, full mouth reconstruction, extreme smile makeover?
It's amazing. I mean, I had one patient who was 92 years old.
Why would a 92-year-old want to do this?
Look, if you're lucky enough to be 92 years old and still be living, you want to eat, you want to chew, you want to enjoy your life. You know, these are the years that you should be taking care of yourself, right? All these years before that, you were worried about your kids, your family, and now this is about you. You're 92 years old. He was at a point in his life, he said, you know what, I want to take care of myself. This is my opportunity now. This is my opportunity to take care of myself. I want to live in this world with something better, the ultimate, the best. So we gave him an extreme smile makeover with a combination of procedures.
Okay.
And we were able to get him a nice, comfortable set of new, beautiful set of teeth that he can eat with, he can chew with, he can smile with confidently, he can speak with confidently. He was a whole new person.
Is that right? Yeah. So if he's 90s, like when a 70-year-old comes in and says, "Doc, am I too old?" They're not even close to too old?
Absolutely not. I mean, I've seen all ranges of ages here. I've seen anyone from as young as 30 to as old as 92 years old to get this procedure done.
Okay, good. Now, correct me if I'm wrong. What you're doing, we talked on the phone, would require a lot of different specialists sometimes. They'd have to be sent to one doctor for this, another doctor for that. And you have this concept of doing it all right there. In fact, I guess this is not a recognized specialty, but like a super specialist office, right? I guess you do just about everything right there. Tell me about that.
Yeah, so many years ago, I looked at it and I said, you know what? There's so many patients that have to go office to office to office, and this could be frustrating.
Like what?
Like getting a root canal somewhere, then going in, getting an extraction, a different doctor for gum disease. I realized that, hey, why does this patient have to go office to office to office? Just makes it simple. Let's keep everything here. We have a whole team of specialists and we can do it all under one roof. And that way the patient doesn't have to travel and we can oversee the whole care to making sure that the patient's well taken care of from start to finish. Because we have an on-site lab, we have actual technicians that specialize in making the teeth right here in the office.
So you can make crowns and everything right there?
Absolutely, absolutely. Okay. We can all, and what's great about it is we can do it in one visit. Now the patient doesn't have to come back and forth, getting numb multiple times, getting injections multiple times. They can all do it in just one visit, which I love because that really gives them that fulfillment to be able to give that patient that service that doesn't require them to keep missing work, keep missing time out of their schedule. They can get it all done in one visit. They're in, one-stop shop, and they're out. And that's what really gives me the satisfaction, knowing that patients are now happy because now they can come in and get everything done in one visit.
Now, you are big on IV sedation. Why is that?
Honestly, I love it because my patients love it. It's something that I've been able to do for them, and they love it. It makes it simple. I mean, a lot of these patients I have here, the before and afters that we've done, they're all been mostly done with IV sedation. Patients don't like going to the dentist because of the pain, the fear, the anxiety. IV sedation solves all that. The technology is there. We have that now to take care of that.
We talked in the green room, and oral sedation versus IV sedation. Most guys, I guess, are doing oral sedation. You like IV better. Why?
Look, I used to do the oral sedation. It works well. But you know what? The IV sedation is a lot better. I'll tell you why. Number one, it actually lets us give you more or less depending on what your body needs. Some patients need a little bit more. Some patients a little bit less. It all depends on how you're doing. So a lot of times when I'm doing an IV sedation, a patient will need a little bit more sedation. So with the IV, it's a lot faster. It's more controlled. We can get it more titrated. We can give it a little bit more, a little bit less.
Could you pull them out of it faster than the pill?
Absolutely, absolutely, yeah.
Okay. So you like IV sedation. And what are you monitoring when you're doing the IV sedation?
So it's very safe. I've had patients in their 90s getting this done. We're monitoring blood pressure, we're monitoring oxygen levels, we're monitoring heart rate, pulse, all of that. It's a very safe. We have all the technology in the room. We're certified. So I just had a patient the other day come to me. She said, "Doc, I went to a dentist. They tried to get me numb. They couldn't get me numb. It was a terrible, terrible situation."
Okay.
And she felt like she got tortured. I said to her, "Well, did you know I can do this with you for IV sedation?" She goes, "Really? You can do that?" I said, "Yeah, IV sedation." She goes, "You know what? I want to try that." And I said, "Because the IV sedation, you're sleeping. You don't feel anything. You don't remember anything. It's great for patients who have problems getting numb or they just don't want to sit in the appointment for hours and hours to get multiple things done."
When you say you could do like 6 months worth of dentistry in one shot because of IV sedation, what do you mean when you say that?
I'll give you an example. I had a patient that needed bunch of fillings done, crowns, they needed root canals done, they needed a whole bunch of work done. And for that, if he was just to get numb and go to the dentist and get numb, go back and forth, probably about 4 to 6 months, probably about 10 visits, we got it done in one visit. And you're probably asking yourself, well, how is this possible? How could you get all that work done in one visit? How is that possible? Well, the answer is simple. With IV sedation, the patient's sedated.
Okay.
They're in a relaxed state.
So they can hold their mouth open longer?
Yeah, they can. Well, we have something that we put in the mouth that helps them stay open, and they're sedated. And because they're sedated, their body's a lot more comfortable, relaxed. They're calm.
Blood pressure's lower?
Blood pressure's lower. Their body rate's going. It's kind of being in a situation where you're in a dream state.
Okay. So in your office, I mean, you do everything. I know you do some dental implants. You do. What about like veneers? I guess you do your own root canals. Pretty much all the dental procedures you do?
Yeah.
Just not pediatric dentistry?
That's correct. We do everything. What's great about it is because we're able to do a lot of procedures in one visit. It saves the patient a lot of time. They don't have to come back and forth to the visit, getting numb multiple times. We have an actual machine in the office. Okay, it's called a milling machine. What it does, it makes the crown in the office.
Okay.
So we're able to give that patient the same day a crown that they can go home with.
Right then and there?
Right then and there.
Okay, good. You have more photos. What else are we looking at here?
So this is Jean. Jean came in. He wasn't smiling. He couldn't smile. He couldn't speak. He had a lisp because of the spaces between his teeth. He wasn't eating well. He couldn't bite into hard foods. He was just not able to be himself. And he was a young guy, probably mid-30s. So Jean, when he came to me, he told me. He said, "Doc, I'm not smiling. I'm in a bad place.
So he never smiled?
Never smiled. He wasn't able to eat chewy foods. Wasn't feeling confident. Working man. Just didn't have the ability to smile. Just didn't feel like he had the confidence." So with the combination of procedures, you can see there, we have beautiful new teeth.
Wow, looks good.
Total smile makeover, whole new person. Look at his eyes, Randy. If you look at his eyes in that photo compared to the one before, in the one before, he wasn't even showing his eyes. He didn't want to smile.
So they're so used to not smiling, they have to keep their eyes closed in the photo?
Yeah.
Really?
Yeah,
okay.
Yeah. I had to actually force him to give me a little bit of a smile. You can see that's a forced smile in that before photo there. After, he just couldn't stop smiling. He was out with his friends. He was going to work smiling. He was a whole new person.
What is it like when they see it for the first time? Like a guy like this?
It's funny. Whenever I hand a patient a mirror for the first time when they're looking at it, something happens to their eyes. I can't explain it to you, but it's like their pupils of their eyes just open up. It's like a whole new beginning. It's a whole new, you can just see it. I really think it's something spiritual. There's something going on in their body from the inner, it comes out. It's like it's a whole new beginning for them. Look at his before and after. Okay. Before, he couldn't smile, wasn't confident, had struggles in his life, wasn't probably getting many opportunities in his career. Look at the after photo.
Yeah.
Would you say that he's more handsome now?
I would.
He is. He's definitely a lot more handsome. You know why? Because it all starts with a smile. The smile is a gateway to our happiness. When we're smiling, when we're expressing and showing and happy and glad, it attracts positivity. When we're smiling, people want to be around us. People want to talk to us. People want to hear about us.
It's like your charisma.
It's charisma. The whole body changes. The walk changes. When he walked into my office when he came in for his follow-up appointment, he couldn't stop smiling. He was walking differently. His head was up high. He was feeling good and confident. He told me he just got a new job. It was a whole new place. It was a whole new career for him. And that's all because of a smile. Why? Because the smile brings happiness. It brings people close.
Doesn't surprise me that a dentist would think that the smile is so important. How important is it?
Look, I get it. It's not because I'm a dentist, okay? It's really because the smile is a gateway to people's confidence. It's a gateway to how people feel about themselves, how they interact with people. When you're smiling more, when you're showing people, when you're out with friends and family, you're smiling, you're out with coworkers. When you're smiling, it changes who you are. It comes from within. It's all about who you are. And when you smile, when you have a nice smile that you feel proud of, and that's the key. Let me give you an example. 2 twin sisters, both the same exact smile. One sister didn't like her smile, one sister did. What happened? They both went for job interviews. One sister couldn't stop smiling. She was charismatic. She was smiling. She was giggling. She couldn't stop laughing. She was in that happiness mood with the employer. She got the job. What happened to the other girl? The other girl came in with her head down, covering her mouth when she was smiling. She couldn't even smile. She didn't feel confident, all because of her mouth, all because of her smile. So who do you hire? You don't hire the one with the prettier smile. You hire the one that's confident, that is charismatic, that's joyful, that's happy, that can't stop smiling. Because that's the people we want to be around. That's the people that we want to hire. Those are the people that we want to bring into our life. The opposite's actually true. People feel judged. People with bad teeth feel like they're being judged. If you look at Hollywood, right? Look at Hollywood. What do they do when they want to make someone look evil or bad or poor?
Yeah.
Or poor. They give them bad teeth. That's the whole psychology that we live in. That's the world we live in.
You have patients that actually say that they feel judged?
I do, all the time.
Like they're unclean, things like that?
I do, all the time. Patients come to me and say, look, when I'm at work, I feel like I'm being judged by my coworkers. They think I'm mean. They think I'm a terrible person. They think I'm poor. Or they think I'm not educated. These are all things that we have that we're conscious about. And it really starts with a smile, because why are those people feeling that way? They're feeling that way because they're not happy. They're not feeling good about their smile. When we give them new teeth, new healthy gums, when we give them a smile makeover, it's a new beginning for them. It's a new start. They're not being judged anymore. They're not feeling...
Is this one of those things where they say, I wish I'd have done this years ago?
All the time. I get that from every single patient I see. I wish I would have known. Why didn't my dentist tell me I could have done this a long time ago? I thought this was who I was. This is who I thought I had to be. And what I'm finding out now over the years, after 20 years, some years practicing, I've noticed that patients have lost hope. And when they come to me, I have to really tell them it's okay.
And you can do it fast. You told me on the phone, one of the last things we talked about on the phone, I think I'm paraphrasing you, but you said, I want people to know that we can do it in one day. That was a big point you wanted to make.
Yeah.
Because you have all the technology, everything right there.
Yeah, I always tell patients, look, anytime we give you a smile makeover, the day you come in, you're going to walk out with a new smile. I don't want patients walking around with teeth that are not working or not going to function or not going to be able to use, right? We want them to come in, get that smile makeover, walk out. And that's what we do, because that's important to me. Why is it important to me? Is because I don't want that patient to be dragged along this process. We have the technology now. We have the ways to make this easier for our patients. Walk in, get the smile makeover that you're looking for, walk out feeling a whole different person.
And that's all the time in your office?
It's all the time in my office. We can do it in one visit. So let me show you this patient, Randy.
All right.
He was a firefighter, couldn't chew, couldn't speak, couldn't smile, married man. His wife actually was the one that made the appointment for him because she couldn't deal with it.
You told me that. A lot of the wives will drag the husbands in.
It's great. It's great because the wives really know what's best a lot of times for the husbands. And she looked at him and said, you know what? You got to change this. You can't live like this.
Because they're sick of them maybe complaining and nagging at home?
Complaining, nagging, just not being themselves, maybe look, women can tell when a man's confident or not. When he's not feeling confident, she's telling him, make a change, do something about it. But he was very scared. You know, when he came in, he was scared, he was anxious, he was fearful. And
scared of pain?
Scared of pain, scared of dentistry, scared of going to the dentist. He had a lot of traumatic experiences as a kid going to the dentist, like so many other people have that I see.
Okay.
And they have this trauma, they have this bad experience, and say, what can I do? You know what, let me just live with this. I'd rather live looking like this than having to go to the dentist. I tell my patients all the time, I say, look, I'm sorry you experienced this in the past. I know it was terrible, and it was. You didn't deserve this. You didn't. But the good news is that today and tomorrow, this is a new beginning. We have a new start. Good news is with the new technology that we have, with the sedation that we have, with the ways that we can do this, you don't have to feel that anymore.
So what did you do for him?
So we did a whole set of veneers for him. You can see that we did a whole new facial smile makeover we did with him. We did some crowns, some root canals, all this while he was sedated. When you look at the before, he didn't like those short teeth. He didn't like the gaps between his teeth. He didn't like the worn down look on his teeth. Look at the after. Look how this smile now beautifully blends into a smile. Look how broad he's smiling now.
Is this done on a computer? Like this kind of smile design, partly on a computer?
Yeah, it's what's great about the computer age that we have right now, we can design a lot of this on the computer. I can actually program and do the designing on the computer before we even touch the patient.
Can you show the patient what it might look like?
Absolutely. I want to make this one point with this patient here. Do you see that before?
Yeah.
If he had walked into one of these places where they specialize in just taking all the teeth out, putting all implants in, and doing that, it would have been a lot more expensive and not necessary, in my opinion. We were able to save his teeth. We were able to give him a whole new smile using the teeth that he had, the foundation that he had. Now, some patients we can't do that with, and we can't save all their teeth, but we can do a combination, saving some teeth, replacing some others.
Okay. We should mention, because on these big full mouth reconstructions, extreme smile makeovers, as we're calling it today, that dental insurance, even the best dental insurance doesn't really cover it. Medicare, Medicaid doesn't cover it. But you say people finance this. You guys set up payment plans for them?
Absolutely. Every single patient that I've seen over the years, no one's going to come in and pay this all at one time. We don't expect patients to come in, have to pay all this at one time. We have ways that you don't have to put any money down. You can break up the payments on a monthly basis depending on your credit. We can get this done for you. If you have a decent credit score, we can get this done for you on a monthly payment.
So you have somebody that actually handles this in the practice?
We have dedicated people in the practice, dedicated professionals in the office that are helping you get the financing you need to get this work done. That's the easy part.
Okay.
Here's a patient of mine that came in, Mark. He came in with a gum infection. He did everything he tried. Not his fault. He tried brushing. He tries flossing. He tries to keep his gums clean. At that point, he was at a point where he wasn't helping.
So
anymore.
bad gums.
Bad gums.
Like gum disease? Is that what they call it?
Gum disease, gum infection, yeah.
So you can't brush and floss it out.
No, unfortunately, no. At that point, he was done. But here's what we did for him.
Okay.
We were able to give him sedation because he was very scared and he didn't want to do anything at first because he was so scared. We gave him sedation, got him comfortable. We were able to give him a whole new smile makeover in one visit.
What about the gums?
We cleaned out all the gums in that one visit. We were able to get it all, a whole new foundation for him. And we gave him a whole new set of beautiful smile makeover
Looks
teeth.
good.
Yeah, looks great. He did amazing. I'll tell
Looks
you what,
more mature in the after.
he does. If you look, Randy, do you see the before photos there?
Yeah.
Does he look like a small kid, or?
Yeah, in a way, yeah.
And he's not smiling much. He's not really showing that many teeth. Look at his after. He's got a broad, beautiful smile now. And you know what that does to him?
What?
Gives him that confidence that he was looking for when he walked in. Head was down. When he first came in, his head was down. He wasn't smiling. He was actually mumbling a little bit. I kid you not. When he would speak with me, before we did this, he was very down. He was just saying, yeah.
In his 50s?
In his 50s. When we were done, he was a whole new person. He was charismatic. He was very smiling with the front desk. He was walking in. He was talking to my front desk people. He was socializing. He was just a whole new person.
Do you think he was on a path to a denture with what was going on?
Absolutely. Absolutely. If he had not done what he did, he would have ended up with dentures and probably been suffering like many patients. 30 million people in America are suffering with dentures. 3 million people in New York State are suffering with dentures.
So you just have to get them early enough.
We got to get ahead of it. We got to get ahead of the game.
Okay.
Here's a patient. When she came in, she wasn't smiling. She didn't like her way that her teeth looked. She did some research on us. She found our reviews online. She said, you know what, let me give these guys a shot. And she came in. When she came in, she said, I said, what brings you in? She said, look, I'm not smiling. Something's wrong about my smile. I don't know what to do. I've been to 3 or 4 different dentists. I've been over these years getting this work done. I keep getting root canals. I keep getting crowns. I keep getting all this work done. And I just still don't like my smile. I don't know what to do. And at that point, I realized that she's the perfect candidate to really help her by giving her a smile makeover.
Okay. Like fixing it once and for all.
Combination of procedures. Were able to get her in a nice, healthy, her gums healthy, her teeth looking good, looking at one shape, size, in terms of color, getting everything to align up. Because what happens is the smile is really just where everything shines. And when someone's smiling, when they're feeling good and everything's looking and blending and they're bright and they're feeling good about themselves, it's like being out on a sunny day, right? When we're out on a sunny day, how does it feel to be out on a sunny day? Everyone's in a good mood. Everyone's smiling. Everyone's happy. And when it's cloudy out, when it's overcast, everyone's down and shy. When she came to me, she was living a cloudy day every day of her life. Every day of her life was a cloudy day because she wasn't smiling. She didn't feel joy. She didn't feel happiness. That's when we were able to help her, get her to there with a combination of procedures. We were able to have her smile. She was smiling more. She was feeling more uplifted. She was more charismatic. She was just being who she was. All these years, she was hiding and holding back of who she was. Once we did a smile transformation, in one day we were able to do it for her with sedation. She was a whole new person. She couldn't stop smiling. It was just incredible. Here's a patient I want to go over with you right now.
Okay.
He wasn't smiling. You can tell if you look at his before photos, broken teeth, missing teeth, couldn't bite, couldn't chew, couldn't eat. His teeth kept breaking. He kept going dentist to dentist, getting tooth extracted after tooth extracted after tooth extracted. He could have ended up with full dentures for all you know it.
Okay.
When he came to me, I said, look, what do you want? What is it? What's going to make you happy? That's the question I asked him. I said, what is going to make you happy?
Okay.
He said, look, doc, I just want to be able to eat again. I want to be able to smile again. I want to be able to go out and have a steak. And I just can't. He goes, I can't. And I said to him, you're not the only one. I see this every day. I see this happen every day. When patients come in, they're not feeling like they can eat, they can chew, they can smile, they can speak. In one afternoon, we were able to change his smile. He walked in like that. Look at the before. He walked in before, walked out that same afternoon looking like that in the after. How is that possible?
What does a guy like this say when he sees himself in the mirror for the first time? I guess they're sedated, right?
They're
But when you
sedated.
see 'em back
They're
on
just waking up. Yeah.
On the follow-ups, what do they say?
When they come in for the follow-up, they don't believe it. They go, I can't believe I waited so long. I didn't know it was so simple. I didn't know it was so easy. I thought I was going to have pain. I thought I was going to have swelling. I thought it was going to hurt. And none of that happened with him. He's now smiling with his friends. He's going out with his friends now when he wasn't before.
Is that what he tells you?
He tells me, and he's eating steaks. He's eating all different sorts of foods. He's eating hard food. He's eating crunchy food. He's biting into apples. He's doing things that he never would have imagined that he can do. All because he opened the door for himself. He said, you know what, I'm going to actually do this. I'm going to actually go and get this done. And that's the first step. You know, that's the first step that's holding people back.
Do they ever say, Doc, you've changed my life?
They do, but it's not all me. It's really them. I'll tell you why it's them, because they're taking that first step. They're opening that door for themselves. And when they open that door for themselves, they see a whole list of new opportunities come about. And that's what changes his life. It's not me. I just do the work. I just do the dentistry. That's just, you know, I go to school. I learn the techniques. I learn the best procedures.
You've traveled all over the world to do this, or all over the country?
I've traveled. I've spent a lot of time in education, because for me, the most important thing is giving the patient the best result whatsoever. And that's what's important to me. But you know what? It's the patients that make the change in their lives. It's not me.
Okay.
I just do the work. It's them making the decision to pick up that phone and give us a call. It's their decision to say, you know what, I'm going to make that appointment. It's their decision to be the brave one, to walk in when they're scared, anxious, having trust issues with dentists, saying, you know what, I'm going to sit in that chair. I'm going to give this guy a shot. And that's what happens, because that's the biggest reward for me. When the patient says to me, you know what, Doc, and this happens to me sometimes, they say, you know what, there's something about you that I just feel it's God-given. It's just something that I feel like I walked in here, I made the right choice. I don't know what it is, but I want to do this with you. And that's what, and to me, that's very humbling, because I didn't ask for that. I didn't ask that patient to give me a call. They just did it on their own. They did it on their own fruition. They're the ones that actually took the initiative. They're the courageous.
So that's the hard part.
That's the hard part. They're the ones that are brave. They're the ones that are
So at least know
courageous.
your options, right?
You got to know your options.
Just
you got to
come
know
in, get a consultation, know the options.
I mean, look, I like to meet people. I enjoy meeting people, hearing their story, because a lot of them have backstories. What happened to them in lives, where they were. Some patients tell me, you know what, Doc, I'm sorry. They apologize to me. I said, Doc, I say, you don't have to apologize to me. And I tell them, I see this all the time. I say, it's not your fault. This is not your fault. You were in a bad situation before. Whether you were growing up in a bad neighborhood, or maybe you were growing up in a bad environment, in a bad house, whatever it was. But you know what? You don't have to live that way anymore. This is a new beginning for you.
And it's fast.
It's fast.
Somebody watching this, really bad teeth and gums. I mean, really bad. They've heard what you have to say. If you had an opening in your practice, next week they could have their new smile.
Absolutely. Absolutely. My answer to you is this. With the technology we have now, we can make this simple, easy, no pain, financially easy. We have payment plans. We can make it work for you. It's all up to you. It's up to the patient to make that first move.
Okay, good. I want to thank you for coming to the show. Good stuff.
Thank you, sir.
Now, if somebody wants to make an appointment, do you prefer they just make it online, or just call your office?
They can give us a call. We could be happy to schedule them in. They can do it online, but give us a call. We'd be happy to get you in for a free consultation. And I'd love to help.
All right. Thanks again.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.